بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على سيد خلق الله محمد بن عبد الله. حياكم الله في ليلة من ليالي إدارة التغذية العلاجية بتجمع حائل الصحي، وتحديدا قسم التوعية والتثقيف. هذه الليلة بإذن الله سنتحدث وإياكم عن تقرحات القدم السكري مع الدكتور البندري عبد الله العمار، استشارية تغذية علاجية ودكتوراه في التغذية العلاجية، أستاذ مساعد في جامعة حائل، تحديدا في كلية العلوم الطبية التطبيقية. سنتحدث بإذن الله عن تقرحات القدم السكري، والتي تأتي تزامنا مع اليوم العالمي للسكري 14 نوفمبر 2021. تفضلي دكتور البندري.
بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف الخلق أجمعين، سيدنا ونبينا محمد وعلى آله وصحبه. الحضور الكريم، يسرني المشاركة بمناسبة اليوم العالمي للسكري، ويسعدني أن ألقي الضوء على دور التغذية كأحد مسببات هذا المرض، وأيضا دور التغذية في الوقاية من هذا المرض. أتوجه بالشكر الجزيل للتجمع الصحي بمنطقة حائل لدعوتهم لتواجدي معكم هذا اليوم، وأيضا أخص بالشكر أخصائي التغذية العلاجية الأستاذ عثمان الشمري لجهوده بإقامة ورش العمل والندوات، والتي لها أثر ملموس في توعية المجتمع تجاه معظم الأمراض والمشاكل الصحية. اليوم إن شاء الله راح أتكلم عن Diabetic Foot Ulcers، اللي هي تقرحات قدم السكري. Diabetes mellitus refer to a collection of chronic conditions that result from poor insulin production or insulin resistance, causing the hyperglycemia. This high blood pressure, blood sugar and lack of insulin cause metabolic disorder, impact the quality of the metabolism, the protein, lipids, and the carbohydrate. Diabetes mellitus is a major health problem worldwide, and the number of people with diabetes worldwide in 2070 was 425 million, and is expected to increase by as much as 45% by 2042 to reach for 629 million. King Saudi Arabia is among the top 10 countries with the highest prevalence of diabetes, and is expected to be among the top 5 countries with the highest prevalence of type 2 diabetes in 2030. The number of deaths attributed to diabetes in Saudi Arabia is about 170,000 adults, which is greater than 10% of all adults in the death in the country. Now I'll talk about the diabetic classification. Diabetes has been classified into 4 subtypes by the Health World Organization and the National Diabetes Data Group. Type 1 refer to insulin-dependent diabetes mellitus, which is result from insulin deficiency due to the pancreatic beta cells being destroyed by the autoimmune system. And around 10% of the diabetes causes are this type of type 1 of diabetes, and usually appear during the childhood and adolescence. Type 2 diabetes, non-insulin dependent diabetes, and result due to the combination of the both beta cell dysfunction and insulin resistance, or defect in the insulin secretion. And about 90% of diabetes causes the type 2 diabetes, and it is most often developed in people over age 45 years. It is possible for type 3 to be present as secondary to other conditions. It can occur as a result of biological event, metabolic event, virus, drug, and chemical or genetic abnormality, and environment factor. The diabetic complications are not unusual and often represent a large cause of illness and death. And last type, type 4, is a gestational diabetes due to the physiological stress or inability to tolerate glucose normally during the pregnancy. And usually it's resolved after the baby born, and it's diagnosed in the between the second and third trimester of a pregnancy. The risk factor for pre-diabetes and type 2 diabetes. There are several risk factors have been associated with type 2 diabetes and include the family history of pre-diabetes or type 2 diabetes, overweight, high blood pressure, unhealthy diet, such as having low high density high density lipoprotein, cholesterol, the good cholesterol, and consume the large amount of the bad cholesterol and high triglyceride level. Impaired glucose intolerance. Also consider one of the risk factor. The complication of diabetic can be divided to microvascular complication or macrovascular complication. The microvascular, which affect the the small blood vessels and can affect the eye, the kidney, also the macrovascular can affect the large vascular such as the brain and cause the heart problem and reduce the blood flow to the leg. The wound healing is a normal biological process in the human body, consists of 4 highly integrated and overlapping phases, which is the hemostasis, the inflammation, proliferation, and maturation phase. I'll give you a brief description for each stage. Phase 1, the hemostasis phase. It's the first phase of healing, begin at the onset of injury, and the objective is to stop the bleeding. So in this phase, the body activate its emergency repair system, the blood clotting system, and form a dam to block the drainage. During this process, a platelet come into contact with the collagen and stick together in order to seal the break in the wall of the blood vessels. Number 2, or phase 2, the inflammatory phase. It is the second stage of wound healing and being right after the injury, focusing on destroy the bacteria and removing the debris and foreign body. essentially preparing the wound bed for the growth of new tissue. So the damaged cells, pathogen, and bacteria are removed from the wound area. Phase 3, proliferative phase. Once the wound is cleaned out, the wound enter for this phase. In this phase, which focus is to fill and cover the wound. And it consists of 3 stages: filling the wound, contraction of the wound, and cover the wound, which is called epithelialization. And finally, phase 4, the maturation phase. Also, it's called the remodeling stage of wound healing. The maturation phase is when the collagen is remodeled from type 3 to type 1 and the wound fully closed. The cell that had been used to repair the wound but which are no longer needed are removed by apoptosis or programmed cell death. The impact of diabetic on wound healing. It's reduced or impaired growth factor production, angiogenic response, and bone healing. It's impaired macrophage and epidermal barrier function. Inadequate quantity of granulation tissue, number of epidermal nerve, and collagen accumulation. It's reduce the keratinocytes migration and proliferation. Also, there is imbalance between the accumulation, the extracellular matrix component, and their remodeling. The stage of wound healing are complex and frequently process failure to the progress in this stage of wound healing can lead to chronic wounds. Also, factors that lead up to the chronic wound are such as the infection, diabetes, metabolic deficiency of the elderly. So, careful wound care can speed up this stage of wound healing by keeping a wound moist to clean and protect from injury, re-injury, and infection. Diabetic foot ulcers, which is non-healing or poorly healing, breaking the skin, muscles, or bone of the foot as a result of the nerve damage, poor circulation, and or infection that is associated with diabetes, which result in the morbidity and possible amputation. Diabetic foot fact. Every 3 seconds, a lower limb is lost amputation somewhere in the world as a consequence of diabetes. The amputation in people with diabetes is 10 to 20 times more common than in people without diabetes. Also, after the amputation, 30% lose other limb in 3 years. And 2/3 die in 5 years. Usually, type 2 diabetes can be worse. 15% of diabetic will develop a foot ulcer. Diabetic foot and the related complication range from ulcer formation to amputation is affect the life of diabetic patient. The amputation can be classified either as a major when the amputation be above the ankle, or minor when it's the amputation below the ankle. The diabetic foot, which is one of the most common complications of diabetes, leads to considerable financial consequence of the patient, their families, and the society. And the prevalence of diabetic foot in Saudi Arabia is reported between 26 to 62%. Treatment of diabetic foot ulcers. To improve the outcome for the diabetic foot ulcers, the treatment protocol must include optimal blood sugar control, effective local wound care, control of sepsis, reduce the pressure area, and restoration of blood flow of the affected area. There are two types of treatment: the surgical treatment or non-surgical treatment. Surgical treatment can be debridement, which is a process used to clean out dead or infected skin and tissue from the foot ulcers. It is also done in order to remove any foreign material from the tissue surrounding the wound. Number two type of surgical treatment, it can be by vascular surgery, maybe perform one or more procedure for to increase the blood flow. And number three, the amputation. The treatment for foot ulcers vary depend on the severity of the wound. So in general, the treatment employ method to remove dead tissue, keep the wound clean, and promote healing. But when the condition results in severe loss of tissue or life-threatening infection, an amputation may be the only option. For the non-surgical treatment, there are different types of treatment. It can be used. It can be use the human growth factor or cold plasma, negative pressure, wound dressing, use the antibiotic or standard therapy. And there are two, which is the stem cells and use the natural product. These two type, actually, I use it in different study for me, purpose to see their effect, and to measure if their effect it's worth or not to apply for the diabetic foot ulcers to avoid the amputation and other health problems. I will explain first the natural product. There has been variety of antioxidant compound identified to have in vitro anti-glycation properties, such as the green tea extract and garlic. For the garlic, there are two groups: similar compound, which is water or oil soluble, or group 2, silver-free active substance. Naturally derived product from a plant to fungi, shell, and minerals are the oldest practice of medicine. But even today, the majority of frequently used the medication are derived from the herbs, and around 1/4 of the prescription drug containing one or more active ingredient derived from the herbs, or compound that is mimic for the natural product. There are a variety of antioxidant compound identified to have in vitro anti-glycation properties, such as as I mentioned before, green tea extract, which has large number of flavonoid, and garlic, which has the high amount of S-align cysteine. The problem of the garlic, as we know, it's smell and harsh taste. So there are different methods used to decrease this odorless, and to make it odorless, and to reduce the harsh taste. Such as the fermentation or soaking. And regarding the soaking, the process of aged garlic extract increase the concentration of antioxidant and convert the allicin and another unstable compound to a stable substance that promote the health, such as the S-alyl cysteine and N-acetyl cysteine. Number 2, for non-surgery treatment, use these stem cells. Mesenchymal stem cells, it's a collection of cells knowing to multi-point stromal cells that have the ability to differentiation into variety of cell type. The mesenchymal stem cells have been known to be a virus name, different name before mesenchymal stem cells, including bone marrow stromal cells and osteogenic stem cells. And I think we are more familiar with bone marrow stromal cells than the other stem cells. Why use stem cells? Because the stem cells play important role in the healing wound, such as they are capable of self-renewing and are able to differentiation themselves into several cell types, such as compromising fat cells, cartilage cells, and bone cells. It is possible to isolate the mesenchymal stem cells from both the adult or embryonic tissue, including the adipose and bone marrow. The mesenchymal stem cells can help to enhance healing in many or different ways. From the encourage the migration of fibroblasts, increasing the density of the microvessels, enhance the thickness of regenerated epiderm, as well as decrease number in the inflammatory cells. Also, it can increase the angiogenesis, enhance wound closure, reduce the inflammation, enhance the skin regeneration, and regulation of extracellular matrix remodeling. Here, I test the effect of S-allylcysteine, N-acetylcysteine, and mixture of S-allylcysteine with N-acetylcysteine in the AGE's formation. I use in the first figure, in the first figure, I use different concentration of S-allylcysteine. First, I did the glycation by incubate the lysosome, which type of protein, with mg for 24 hours. After that, I add the S-allylcysteine, the inhibitor, in different concentration to see its effect. As you see from lane 3 till 10, the dimer start to decrease. That's mean S-allylcysteine is effect to inhibit or stop the glycation. After that, in the second graph, second figure, I use N-acetylcysteine in the same concentration that I use it with acetylcysteine, and also found gradual inhibition. Then I was thinking to mixture S-allylcysteine with N-acetylcysteine, because at that time nobody tested before me to see if there is effect or not. And actually I found the effect mixture of S-allylcysteine and N-acetylcysteine together more than effect SAC or NAC alone. Here I measure the effect of S-allylcysteine mixture with N-acetylcysteine on bovine aortic endothelial cells glycation, and I found same result. It's a gradual inhibition. If you see lane 9, compare it with 3, there is a great inhibition. Now I use the drug, but loaded with human adipose mesenchymal stem cells, collected media, to see if there is effect or not. Yeah, by the way, here I use the stem cells, mesenchymal stem cells, as a vehicle to arrive the medication for the affected area. I mean, beside the different their role in wound healing, it's also can use as a vehicle to arrive the drug to infected area. That's why I use the S-allyl-cysteine and N-acetylcysteine loaded with human adipose mesenchymal stem cells, collected media. I tested for 1 day and day 1 and day 2, day 3 to see their effect. And I found in day 1 and day 2, the mesenchymal stem cells absorb, then release the drug put with look like after treatment with which increase the growth factor and the other factors. So number 1, it's only bovine neurotic endothelial cells just treated with stem cells collected media without a drug. Why in number 2, I use 2 microgram per ml S-allyl-cysteine and N-acetylcysteine together, but without the collected media. Number 3, the picture, I treated the bovine neurotic endothelial cells with collected media for day 1, the collected media which release from the stem cells after 24 hours without any medication. Number 4, the second day. And number 5, I treated the cells with S-allyl-cysteine, N-acetylcysteine, which paired with human adipose mesenchymal stem cells for day 1 and the other, number 6, for day 2. If you can see here, the cell, the gap, these 2 black line, I did cut in the cells. And when I use the stem cells media, this cut start to be smaller. And here, when I use sac and neck alone, as compare, number 2, compare with number 1, the gap is closer, more than the figure 1. Also same for day 1, collected media alone, day 2, collected media. But the interesting result, which I found it, when I use sac and neck pyramid human adipose mesenchymal stem cells collected media for day 1, the cell migrated cells more than the other. Even the second day, there is increase in the migration, but it was less than the first day. Same thing, The first one for I did the test for cell migration, and the other one for tube formation. The tube formation look like the circle formation to kind of wound healing. Same thing here. Number 2, when I use sac and neck alone, the tube formation, it's more than the tube formation for when I use the stem cells media alone. Also, the sac and neck, number 5, sac and neck, primed human adipose mesenchymal stem cells, the collect media, day 1. If you can see here, a lot of tube formations as compare the other. That's mean it's accelerate and improve the wound healing. The conclusion, the anti-glycation activity of edge garlic extract is mainly due to its organosulfur compound. The organosulfur compound include S-allyl-cysteine and acetyl-cysteine are well known to be exhibit free radical scavengers effect. The limitation of my study, an in vivo study, I did just the in vitro. So the in vivo study on the effect of S-allyl-cysteine and N-acetylcysteine on diabetic patient wound healing was not included. Also, there has been no report relevant of the effect of sac-NAC mixture loaded with human adipose mesenchymal stem cells collected media on wound healing, and there is no any previous result to compare it with my result. Thank you for listening, and I appreciate for your attendance. And if you have any question, I'll be ready to answer it.
شكرا دكتور البندري، الله يعطيك العافية، ألف شكر، شاكر ومقدر لهالمشاركة، لمعلوماتك ودراساتك ومستحدثات اللي هو السكري، الله يعطيك العافية. الآن نفتح باب الأسئلة، اللي حاب يسأل أو عنده سؤال بإمكانه يكتب بالشات، تفضلوا.